Hello everyone, good evening, namaste. I'm sure you all will be happy at your places and doing well. And at the very onset, thank you so much for sparing your valuable time and coming here. It
Himanshu,
was a
just a
long
minute,
time
please.
for me to have such a group, to have
Hello.
Video has stopped.
Video has stopped. So I take this opportunity to welcome you all on behalf of the Counselor Empowerment Program. And I'm so glad we have crossed 400. 400 par ho gaye hain. And we have all connected together on this lovely evening for this beautiful program, which is the brainchild of our mentor, Dr. Pankaj Talwar, who is the IFS president. And today we will be doing the launch of the program. And I'm the national coordinator of the Counselor Empowerment Program. And with me, I will just be sharing my screen. So this is the agenda for today. Is my screen full screen ho gaya hai? Can you hear me?
Yes, ma'am.
Yes.
Okay.
Ma'am,
Yeah.
Dr. Picky, can I get this opportunity first to introduce you?
Yes. Please.
So, Dr. Picky Saxena, who is a national coordinator of Counselling and Empowerment Program of Indian Fertility Society, convener of a special interest group of early pregnancy in IFS, and in charge of ART services at the Lady Harding Medical College.
Thank you, so Dr. Poonam. That's enough. So thank you so much for the kind introduction.
And so many gold medals as well.
Himanshu, my slides are stuck. It's not moving.
Ma'am, click on the slide, yeah.
Okay, so I take this opportunity to introduce, I think sir needs no introduction, but this is Dr. Pankaj Talwar. He's the president of the Indian Fertility Society. And sir has so many laurels that it is very, very difficult to tell you about his elaborate works and the medals and the achievements that he has received. He's the person who had this vision of creating this counselor empowerment program. The ART law has come which says that each clinic should have a counselor, but there's a dearth of the counselors in the country, and we do not recognize the importance. So it was sir's vision to start this, and sir's vision is sabka saath sabka vikas, and that is why he is trying to create lot of new things. He's an innovator, lot of new initiatives. So we will see how this program goes, and sir is extremely happy that we are all working together as a team, the clinicians and the psychologists, and I'm sure we will be able to do a good job. I would take this opportunity to welcome Dr. Shweta Mittal. She is the General Secretary of the Indian Fertility Society. She is co-director and unit head, Center of IVF and Human Reproduction at Sir Gangaram Hospital. It is really a pleasure to introduce Dr. Geeta Khanna, the beautiful lady who is the Scientific Director, ART Unit, High Risk Pregnancy Unit, and Endoscopic Surgery Unit at Ajanta Hospital and IVF Center, Lucknow, and is currently Vice President, Indian Fertility Society, UP chapter. Welcome, ma'am. Dr. Poonam Nair, I think all psychologists must be well aware of ma'am. She is a highly accomplished psychologist, and she is also our mentor and the convener of SIG Counseling Psychological Support. And we have two very young, enthusiastic, expert counselors, two psychologists who are going to do a great job today. And they have been working very hard to make a role play. And this is Dr. Richa Agarwal. She's currently working at Gauri Ridge IVF in North Delhi Nursing Home and Tanman Clinic. And we also have Dr. Poonam Kashyap. She is a young, very enthusiastic, and very innovative counselor. We also have with us Astha. She's not a doctor. She's a senior data analyst and AI specialist. So she is going to prepare an AI app for patient support group for us. So the program for today, for the launch program, it will be the vision of Counselor Empowerment Program by none other than the President, Dr. Pankaj Talwar, and followed by introduction and roadmap of CEP by myself. Then we will have a very interesting role play between a patient and a counselor, which will be played by Dr. Richa and Dr. Poonam Kashyap, followed by a dialogue between two senior counselors regarding what situations they face when the couple comes to the ART counselor. The important questions will be discussed. All these will be short duration, so you will not get bored. And finally, Dr. Astha, sorry, it's not a doctor, Astha Puri, AI expert, will be giving the first information regarding the launch of IFS Support Group app. And I would also like to tell you that we have created a Google page where we request all of you to please enter. It's a very small thing. You have to write down your name, designation, affiliation, so that we have your database. And when we are doing webinars or physical programs, we will be able to involve you and your suggestions will be most welcome. Finally, at the end, our mentor, Dr. Geeta Khanna, would be giving the concluding remarks. So I would like to introduce you with the 4 team members who have really worked very hard to make this program. And the vision is that we want to make a small pamphlet on behalf of IFS, which will be a ready reckoner, because many of the places are not having a proper psychologist. And nowhere, I think, the training is being given how to do counseling for an infertile couple for ART. So it involves very specific, very long procedure, and there are a lot of questions. So we had this. You know that the president is Dr. Pankaj Talwar, General Secretary is Dr. Shweta Mittal, mentors are Dr. Geeta Khanna and Dr. Poonam Nair, national organizer. National coordinator is Dr. Vicky Saxena, myself. So we had 6 teams, for doing this huge amount of work, and each team consisted of doctors and counselors. So it's a teamwork that we are doing. Team 1 was Dr. Vicky Saxena, Dr. Richa, and Dr. Poonam Kashyap. Team 2 is Dr. Leena Vadpa, Dr. Veena Acharya, and Dr. Aarti Anand. The blue and green are not clinicians. They are the psychologists, and the black ones are the clinicians. And you can see one green, Dr. Rajvi Mehta. She is an embryologist. So we are lucky to have at least one embryologist, so we can take her point of view also, because embryologist's role is also extremely important in the integrated ART approach. So the third team is none other than Dr. Poonam Nair, Dr. Shweta Gupta, who is a very senior director in the of IVF Center, and Dr. Mirambika, she's a professor in NIHFW. Dr. Geeta Khanna, madam is our mentor, and I've just introduced her. Dr. Rita Mahi, she is a associate professor in AIIMS, New Delhi, and Dr. Amita Puri, another very accomplished, very senior psychologist with us. And I congratulate her. Her book has just come up and she shared it with me. I'm sure we will gain a lot after by having so many accomplished psychologists with us. We have Dr. Renu Tanwar. She is a professor at Maulana Azad Medical College, and she is the IVF in charge. Dr. Rajvi Mehta, as I said, she's a very senior embryologist from Mumbai. Dr. Rajni Bagga, a very accomplished, a very passionate counselor who has headed the department at NIHFW, National Institute of Health and Family Welfare, for a long time. And she's done a lot of original work in IVF and infertility and counseling. We have Dr. Anupama Bahadur. She's another very enthusiastic young doctor she's an associate professor, or I think she may be more senior, from AIMS Rishikesh. And we have Astha, who is, I've wrongly written, I thought she's a doctor, but she's an engineer and an AI specialist. So going to what is actually ART counseling? We all know that IVF can be a long, physically and emotionally challenging procedure. Counseling before IVF will help the couples to have a realistic expectations and prepares them mentally and emotionally to undergo treatment and face the challenges. Counseling cannot be done at one go at one time only. It has certain steps. In the first meeting, maybe there is information exchange. You take a thorough history and follow up what previous IVF treatment she has taken, gather knowledge about them, understand the couple. And in the same sitting, you are telling them about what is going to be done in the IVF center. Then the doctor decides what is the procedure to be done. The clinician is going to decide what is the procedure to be done. And the couple comes back to us, comes back to the counselor for pre-IVF. After that, during the process of IVF, so many times they come to you for support, and sometimes therapeutic counseling is also required after negative results. So, coming to why have counselors? So this is the Gazette of India, the ART Act, which came in 2021 and noted in 2022. So the categorization of ART clinics is now in two categories. ART level 1, where only IUI is done, and the ART level 2, where IVF is done and where we play with the gimmicks. So the minimum staff required for level 2 clinic mandatorily is one gynecologist, one anesthetist, one embryologist, and a counselor. This is a must requirement, regulatory requirement as per the ART regulations. Additionally, there may be a director or an andrologist in level 2 clinic. So we did a survey, and as per the ART 2024, this thing, we came to know, we want to tell you the educational qualifications of a counselor. The person who is a graduate in psychology or clinical psychology, nursing or life sciences can be a psychologist. But who is actually providing counseling services in various ART centers? We did a survey and found it is sometimes very rarely the psychologist, otherwise it is the nurse or a social worker could be there. It may be an office staff, a doctor herself, embryologist, or sometimes there is no one. They have no concept of having a counselor in place. And sometimes when there is problem, they call the counselor, or at few places they have a full-time counselor. So another question is, where should counseling be done? There is always a space crunch, and sometimes, you know, there's a table and a chair I've seen where the counseling is being done. So that is not the actual thing to be done. Counseling is a serious procedure, and for this you need a separate room. Counseling room has to be there with privacy in the ART center, where the couple can discuss and feel at ease while engaging in the discussion with the counselor. So I think there is a pivotal role of counselors in the ART clinic. They form a link between the patients, clinicians, and embryologists. For clinicians, for us, the OPD is so heavy. The patients are undergoing different phases, different types of patients are there. There is no privacy, and there is always a lack of time. So counseling room and the counselor is one place where you feel safe. The couples can go and discuss their problems, and they can be comforted. A person who can talk to you, understand you, not just your physical, but also mental, psychological, emotional, your relationships, your societal position. So that is what is the base of counselor in the ART clinic. So when a patient is coming for counseling session, it is vital to understand the details of the treatment, address the queries, myths, and fears, and also to give them a realistic view of what to expect. Not 100% are going to become pregnant, depending on what their clinical characteristics are and what the circumstances, what is her age, obesity, any medical disorder that she is having, her ovarian reserve, her husband's problem, all those things, whether she is within the legal age group which is permitted, all those things, her financial status, these are well explained by the counselor. So counseling gives a clear idea about the financial implication of the treatment also. In the counseling procedure, first step I said was information exchange, where detailed personal history, including medical, sexual, fertility history is taken. High risk factors are noted. We tell the patient that these are the medical conditions which may influence your fertility and the vice versa. The treatment may also worsen some of the medical conditions. So you have to titrate and play with the doses, the drugs, all those things. So implications of treatment on her medical condition and vice versa, and individual challenges. It's a very obese woman. It will be difficult to do ultrasound to properly visualize during follicular monitoring, and equally challenging to do ovum retrieval. So all those things, chances of infection may be there. If it's a poor ovarian reserve, even high doses of gonadotrophins may not lead an appropriate optimal number of oocytes. All those things need to be told to the patient. Before the IVF, pre-IVF counseling is done, in which we will be telling, the counselor will be telling the patient about her blood reports, which have already come, her condition, she will be explaining it to her, then how the ovarian stimulation will be done, how many injections, what time, for how long injections, they are all scared of the injections because of pain. So injections will be given, and she will have to come for transvaginal ultrasound. Ultrasound will be done from the vagina, not transabdominally. And every time, and when she gets optimum number of oocytes, there will be ovum retrieval. And what will be the anesthesia given? How much time it will take? Does she need rest after it? All those things need to be explained. Then how many eggs, how many ovum could be retrieved? In the lab, what procedure, IVF, ICSI will be done? Whether it will be a fresh embryo transfer or a frozen embryo transfer. Then after 2 weeks, she will have to undergo a urine pregnancy test, whether she has become pregnant or not. A negative news may give her anxiety, grief, depression. So the counselor will deal and support her during this time. And if she becomes pregnant, IVF pregnancy have their own risks. So she has to be under close monitoring with the doctor. So during the counseling procedure, realistic ideas regarding the rate of fertilization, implantation, clinical pregnancy rate, and live birth rate need to be given. The chances of complications and risks like ovarian hyperstimulation, multiple pregnancy, abortions, ectopic pregnancy. Sometimes you get no follicles, although you have given a high dose of gonadotrophins, but sometimes there are no follicles. On the other hand, there may be multiple follicles, and there may be chances of ovarian hyperstimulation syndrome, which is a serious condition, or multiple pregnancy. The risks caused by multiple pregnancy could be there. And of course, the risk of anesthesia and surgical procedure may be there. Then the counselor also needs to tell them the regulatory requirements to fill in all these consent forms, form 6, 7, 8, 9, 10 to 15, depending on what procedure she's going to do, and also take their IDs, the registrations, certificate for marriage, their photographs, keep their documents in place. And then the most important question is, what is the cost? So what is the cost implication, and how they can make the payment at one go, or how it is done? All those things are big queries in the questions of money. So now, at present, we have the approach of integrated ART approach. What is this? This is the comprehensive or holistic care, which, as I said, will not be addressing just the physical problems, but also emotional, psychological, social aspects, relationship between husband, family, society. There will be collaboration and cooperation between the clinician, the whole team, embryologist, nursing staff, anesthetist, counselor, andrologist, and all the supporting staff to enhance fertility and give a positive experience to the patient. So there is a very good, there should be a very good collaboration between all the team members so that they can have a personalized treatment plan for involving the multidisciplinary team of all these key members. There should be enhanced communication. There should be regular interdisciplinary meeting of all the key team members, and they all should know. They should be at the same page, and they should be knowing regarding the progress of the patient, the adjustments in the treatment, and any arising issue. Finally, the emotional and psychological support at the time of anxiety, depression, stress, which is definitely there in all infertile couples. The members need to discuss possible causes. We all have to put our minds together. Sometimes the embryologist tells the clinician that he wants so many eggs, or they discuss how many eggs to be transferred, causes of failure. Then we need to give time to the patient to recover from stress, which where the counselor again will play a very important role, and also plan subsequent cycles to improve the chances of success in future cycles. Enhanced problem solving, if all the people collectively decide or put their thinking caps, then they will be able to get innovative solutions and provide comprehensive management strategies. This is definitely going to improve patient trust and satisfaction. They feel supported, well cared for. It's a cohesive environment, and they experience more satisfaction with their treatment. Then, of course, we need to give them a contact number, maybe a mobile number, that the WhatsApp message can be sent, or you can talk during this time to that time, and email can be given, and feedback forms. I think it is very, very important. Our team has developed a beautiful feedback form where you can critically evaluate your own, if you are getting consistently low levels of mark, then there is something to be looked on and scope of improvement. Finally, this is the Google form which Dr. Astha Puri will be telling you about. I request you all, it is there in the Counselor Empowerment Program group. You can fill this small form, and it will help us to include you. And she will also be giving the first information regarding the fertility journey support app. So that is all for today. And I thank you all for a very patient hearing. And after this, we go ahead, and I will request Dr. Richa Agarwal and Dr. Poonam Kashyap to please carry on with their very interesting session on role play. Dr. Richa.
Thank you, Dr. Picky. And I'm really glad to be the part of this such an auspicious program. So to start with, let me give a little briefing about the case for which we are going to do the role play with setting in certain counseling rules. So psychological counseling plays a crucial role, as Dr. Picky had already explained in such a great manner. So it plays a crucial role in infertility treatment, as it addresses the emotional and mental well-being of individuals or couples who go through the challenges of infertility. It can help them cope with the stress, anxiety, depression, and feelings of inadequacy that often accompany fertility issues. So counseling provides a very safe space for individuals to express their emotions, explore different types of coping strategies, and work through any psychological barriers that may impact their treatment. So let's understand this with the help of a real case. So a 30-year-old female married for 8 years, a businesswoman by profession, was referred to us. The patient came to us for the primary infertility for 5 years. She already had 1 failed IUI and 2 cycles of stimulations. Her husband is a 30-year-old IT consultant by profession. He is hypertensive and on light medications. He drinks and smokes occasionally, and the sperm count was found normal. So let's see what was the conversation that was held between the counselor and the patient.
Hanshu, please play the role play.
Hi, Sia. How are you feeling today?
Hi doctor, I'm not feeling very good. बहुत sinking feel होता है. You know, always ऐसा लगता है कि कुछ गलत हो रहा है मेरे साथ या गलत होने वाला है और मैं रोक नहीं सकती इन feelings को. बहुत prominent है.
Yes, yeah, I can understand it is, but it's very, it's completely normal to feel that way. IVF journey in itself is a very big emotional roller coaster. So let's take it one step at a time. Let me ask you one thing. What specifically is there in your mind right now? आप क्या सोच रहे हो? क्या चल रहा है दिमाग में जो इतनी घबराहट और सब चीजें हो रही हैं?
Not exactly एक बार में बताना बहुत मुश्किल है डॉक्टर, बट चीजें बहुत डिस्टर्बिंग है. प्रोसीजर्स के बारे में सोच के बहुत ऐसा लगता है कि पक्का कुछ गलती होगा, सही नहीं जाएगा. एंड सोने से पहले बहुत घबराहट होती है, बेचैनी होती है. आई डोंट नो व्हाट एग्जैक्टली वी कैन कॉल दिस.
I can understand. ये कब से हो रहा है आपको सिया?
सो ये बहुत पहले से था, मगर ये ज्यादा प्रोमिनेंट तब होने लगा when I lost my father-in-law few months back.
Oh, that's so sorry to hear.
मैं बहुत क्लोज थी उनके, और इस घर में एक वो ही थे जो मुझे बहुत ज्यादा समझते थे. And now I'm actually going in a journey, entering somewhere जहाँ पे मुझे actually एक emotional support की बहुत जरूरत थी, and तभी वो नहीं है मेरे पास. So, you know, my mother-in-law is just like any other mother-in-law. I can't share my feelings with her. My husband understands me, but I can't force him or can't like tell him what exactly I'm looking for. I don't know किससे share करूँ.
See, we are there always to help you, but outside external support system is fine, but at least you need your family to support you. It's really sad to hear that you lost your father-in-law. So, and I can feel like you were very much connected to him. So have you ever thought of working, sorry to ask you, like when did this happen?
Doctor, few months back.
Okay. And do you feel that you are getting those घबराहट वाली feeling और ये सारी चीजें तब से हो रही है ज्यादा आपको?
So इससे पहले I lost my father when I was just 9 years old. और उसके बाद मेरे फादर इन लॉ ही थे जिनके साथ मुझे एक्चुअली अपने फादर जैसा कनेक्शन फील होता था. एंड नाउ आई डोंट हैव बोथ ऑफ देम इन माय लाइफ. तो अब ये फीलिंग्स बहुत बढ़ गई है और मैं इन्हें कंट्रोल ही नहीं कर पाती. एट द सेम टाइम आई कांट एक्सप्रेस दिस टू एनीवन बिकॉज ऐसे कोई एग्जैक्ट सिम्टम नहीं है मेरे पास बताने को.
I can understand. एक बात बताओ कि when I'm so sorry अगर आप just to heal you we are doing this. If you feel comfortable then only you speak about it. Otherwise we'll switch to some other thing. Like have you ever thought of did you ever process your grief when your father was gone when you were that small?
मुझे तो पता भी नहीं है क्या होता है.
You were very small, so you don't have an idea. See, sometimes what happens, there are so many unresolved fears, unresolved certainties, and losing your loved one is a very big thing. And sometimes it happens, you cannot see those symptoms as soon as it happens, but they hit you back after so many years. And you felt that connection with your father-in-law that much. So feeling that way is quite normal. So I would recommend before we enter the journey of IVF, I would definitely recommend that you should process your grief alongside, because that would be very, very helpful. as in IVF in itself is a very big, as we were talking, like emotional, roller coaster. So हमको अपने emotions को, अपने thoughts को, because anything which we think, definitely it comes to our physical being. So वो हमारे process को कहीं ना कहीं affect करेगा. So I would definitely recommend कि आप जो है उस चीज को थोड़ा सा हम उसको side by side process करेंगे, right? Does that make sense
जी,
to you?
A lot.
Okay. And as we are proceeding towards this, so I would definitely say कि आप अपनी mother-in-law के साथ you should try to build up, a good relationship. I understand it's very difficult to, have that connection with your mother-in-law, but it will be a very good support to you, because what we are dealing with right now, it really needs support from our loved ones. So in that
Right.
case, and you can try, have you ever thought of expressing your feeling to her?
मदर-इन-लॉ तो मेरी भी कुछ हेट नहीं करती मुझे, आई एम श्योर, बट हाँ डॉक्टर, अब जैसे आपने मुझे समझाया है तो मैं ट्राई करूंगी अपनी फीलिंग्स को ज्यादा उनके साथ शेयर करने की. आई थिंक मुझे रोता हुआ देख के उन्हें बहुत गुस्सा आ जाता है, तो मैं उन्हें
I can.
समझाऊंगी कि ये क्यों होता है मेरे साथ.
Yes, it's always good to communicate nicely with your loved ones, actually. They should know how you are feeling, then only they can help you. Right. Acha, have you ever tried any techniques, stress management techniques in your?
मैंने मेडिटेशन ट्राई करा, बट सच बताऊं डॉक्टर, इट्स सो डिफिकल्ट टू फोकस ड्यूरिंग मेडिटेशन. मतलब आई लूज माई फोकस और मैं छोड़ देती हूँ बीच में.
Okay. I can, this is, meditation में ऐसा होना बहुत normal है. When you are not in the practice, so it sometimes happen कि आपको वहां तक जाने के लिए समय लग जाता है. अगर आप consistently and don't think that meditation is something which will, you'll just sit and you'll reach out some other place. It's not like that. It is basically a practice which will come only and only when you are being consistent and, regular on your things which you are doing. So, would you like that I should share some resources with you which will help you coping with your this stress?
आई थिंक बहुत अच्छा होगा कि मेरे पास कोई मैटर होगा जिसको मैं देख सकूं, कोई रिसोर्सेज होंगे जिन्हें मैं यूज कर सकूं.
Yes. I will definitely share with you. मैं कुछ आपको guided meditation resources of mindfulness exercises भी सिखा दूंगी जो आपको इसको panic attacks को control करने में, अपनी anxiety को control किया control नहीं manage करने में आपको help करेगा. So देखिए, it is very important कि ये सब चीजों के साथ साथ आप अपने support network पे भी अच्छे से काम करें. आपके, if you don't mind me asking, आपके partner ये सब कैसे handle कर रहे हैं? How is he taking all this process and everything?
So my partner listen to me और साथ भी रहते हैं, बट जस्ट बिकॉज ही हैज अ लॉट ऑफ वर्क प्रेशर, मुझे लगता है अगर मैं भी प्रेशर दूंगी तो अच्छा नहीं लगेगा. बट हाँ, आई नो वो मेरे साथ तो है इस जर्नी में.
That's really good. It is very important that you both understand each other, and if you want, we can have a private session together with your husband so that it will not only help you in this IVF journey, but also to build your relationship in a more stronger way. Does that make sense to you?
A lot.
Okay, then we'll definitely plan about a counseling session with him. So, anything else you want to ask me? Any others? Like, how are you sleeping these days?
Sleeping is just like that. मैंने बताया है ना, बीच बीच में घबराहट आने से sleep cycle disturb हो जाता है.
Okay, so what do you do at that time?
जागती हूँ, maybe phone scroll करती हूँ.
Okay, but any other, whenever it happens again, just give it a try that you follow a sleep hygiene regularly, just to improve your sleep, because it is very important that you should work upon your sleep as well. Because if you sleep nicely, other day you'll get in a very good mood, and throughout your day you will feel much better and lighter. To do that, you just follow certain things, which is maintaining your routine, doing some physical activity, at least for 45 minutes per day. And definitely deep breathing will really help you. So you can do either box breathing, we can do diaphragmatic breathing. वो हम आपको एक personal session ले लेंगे जिसमें we'll teach you. And in inducing sleep, progressive muscle relaxation is also a very good thing, which we can go ahead with. Right?
Okay, doctor.
So
Doctor,
definitely,
one more question
yes.
I have.
Yes.
वैसे तो आपने ऑलमोस्ट सारी प्रॉब्लम सॉल्व कर दी, बट कुछ फ्रेंड्स और क्लोज रिलेटिव्स दे ऑलवेज आस्क एंड दे ऑलवेज शो देयर कंसर्न कि अब क्या चल रहा है आईवीएफ में, और आईवीएफ कराया ही क्यों, और kindred questions. So what
I
should I
can
go
understand.
for?
So देखो, याद रखो सिया, कि दूसरे लोगों का साथ आपकी आईवीएफ की जर्नी के बारे में कितना शेयर करना है, कितना नहीं करना है, इसके बारे में आपको कंप्लीट बाउंड्री सेट करनी पड़ेंगी उन लोगों के साथ. बिकॉज आई नो जो अच्छे इरादे वाले लोग भी है ना, कई बार अननेसेसरी प्रेशर हमारा बढ़ा सकते हैं. So it is
Right.
always better that you set boundaries with them. आप उनको clearly भी समझा सकते हो. And it's not, I am not saying that you become rude with them or just show anger to them, but it's in a very well mannered way. You just explain them that I acknowledge your concern, but I need my own space to heal. And whenever any good news will come, definitely you'll get it yourself. Right?
Okay, doctor.
So, like anything else you want to ask?
No, thanks.
And how are you feeling after like talking? And do you feel any better? Like, do you think
Very,
you
very
feel
light. Yeah, I feel very light. I feel now I have answers to a lot of my questions. क्योंकि ट्रीटमेंट के बारे में तो डॉक्टर बता देते थे, बट उसके आसपास की चीजें I had no one to talk about.
Yeah, I'm glad to hear that. याद रखिए, आप इसमें बिल्कुल भी अकेले नहीं हैं. हम हर कदम पर आपके साथ हैं, आपका साथ देने के लिए तैयार हैं. Let's do one thing. Let's schedule another session to check in how you are doing and to continue working on these strategies which we have already discussed. Does that sound good?
Yeah, a lot better.
Okay, then. Then Sia, we'll meet another next week, same day, same time. Is that comfortable for you?
Yes, yes, doctor.
Okay,
I will
then.
be.
Okay, then. See you, Sia, next week. Till then, take care and we'll talk soon.
Thank you, doctor.
You're welcome. So, as you can see that in this case, psychological counseling had helped the patient navigate her emotions, communicate effectively. She had learned many communication skills and tried to develop coping mechanism to deal with changes of infertility treatment and other psychological issues. A counselor can provide the couple emotional support, help them manage stress, and improve their mental well-being. Through counseling, they may gain a better understanding of their feelings, learn healthy ways to cope with their emotions, and strengthen their relationship. This can definitely enhance their overall well-being and improve their chances of successfully navigating the complexities of infertility treatment. So in conclusion, I would like to say that psychological counseling is a vital component of infertility treatment, and as it addresses the emotional aspects of infertility and supports individuals or couples in managing their mental well-being throughout the challenging journey of fertility treatment. So now we will be having an engaging dialogue between counselors regarding why counseling is important in infertility. Over to you, Dr. Poonam Nair.
Dr. Richa, just a minute. I think Dr. Pankaj is there now. Actually,
Okay.
sir is in Kashmir and there is an installation ceremony going on. So, Himanshu, can you connect us with sir? We will just hear sir's message for us, and after that you can.
Sure, sure.
Himanshu?
Hello everyone, good evening, namaste. I'm sure you all will be happy at your places and doing well. And at the very onset, thank you so much for sparing your valuable time and coming here. It was a long cherished dream for me to have such a group, to have such an organization of the people who care for each other and care for the patients. And I think today the dream is being fulfilled. It was my long desire to do it one day, and I think today is an auspicious day. And as I start, few words which I want to speak to all of you, I would like to thank Dr. Picky Saxena for leading it from the front and helping me to achieve this particular dream. I'm so grateful, Dr. Poonam and Dr. Geeta, for being our mentors and guiding us through. I can't thank all of you enough. So many of you have worked to bring us to this particular day. To all of you, a big thanks and greetings from Indian Fertility Society. It was around 15 years back. I had a very funny incident. We had a unit which we were looking after, and that unit wasn't getting pregnancies. Everything was fine, everything was good, but they didn't have any pregnancy for a long time, 4 to 5 batches. And when we went to audit it, we found that they were not giving the patient luteal phase support after the IVF. Everything was absolutely good embryos they were forming, they were doing day 3 transfers, everything was absolutely okay. But there was some person, probably a nurse, who had to tell them that they have to start with your luteal phase support. And there was a time when we were doing all fresh transfers. So they lost around 3 to 4 batches because the luteal phase support was probably not recommended in the right way. The things have been happening for a very long time. We as doctors are very busy, and we are primarily concerned with the patient surgeries, their outcomes. We operate and then we go back to our OPDs. We always lacked a link, which are you people who could actually speak to the patients and give them the right advice. This job for a long time was being done by the nurses. But the nurses again are pretty busy. They are in the ultrasound room, or they're in the OTs, or they're in the OPUs. So I'm so grateful to the government of India, which has brought in the concept of counselors. Counselors we always required. Counselors we always needed, but somehow this part was being skipped and missed. But after the 7 June notification, the counselors have become compulsory for all the organizations. And with this came to my mind that we should have an organization within the organization, which is meant for all of us, which could guide the patient towards the right management protocols. It's not only the financial counseling, but it's about everything: what to eat, how to dress up, what to feel, how to share your feelings with everyone around. Because the patients are a bundle of nerves. When they come to us, they're a bundle of nerves, and somehow we don't have time for them. We may spend some time with them in the initial counseling patterns, but later on we all tend to get busy. So we need someone who can actually talk to them, in front of whom the patients can threadbare their heart, cry, feel happy, celebrate, and then follow the right protocols. The role of a counselor is a very important one as per me, and I feel that you all are doing a great job to the whole community. No IVF center can work without a counselor, and today we are blessed that all of you, such learned people, are here to guide us through. I can't take all names, but I've been seeing your communications, and I'm so happy that all of you are so involved in patient management. On the other hand, we've got a lot of people who have joined to learn. I think counselor may be a degree, it may be a psychology degree or something, but important part is that anyone who can talk to the patients can be a counselor. Government mandates a counselor for every unit, which we should all have, but I think we should all remember that counseling is what we should all learn. Counselors are not ordinary people. So guys, you're not ordinary people. You are very special people, and counselors are the one who are primarily psychologists, who can read mind, who can think one step ahead. I remember the counselor which I had at the army hospital around now 20 years back. I could never understand what she was doing, but I knew that I required a counselor at that time when we were doing around 150 pickups per month. She used to sit with the patient and they had to draw some trees, some birds, some huts, some mountains, and then she could read their mind. I never knew what she was doing, and never I could actually understand what was the outcome of that. But today I'm sure that we all are gradually evolving and knowing that we all need counselors, and we all need counseling for ourselves also. It's very, very common that we forget to prepare a checklist. We tell people what to do verbally, but we forget to make a proper checklist. So counseling is one important role, important part where we can make checklist, we can guide people, where we can speak to them, we can take them through a difficult journey, ups and downs of an IVF cycle. And this is what Dr. Picky and our mentors, Dr. Poonam and Dr. Geeta Khanna, wants to do. And I'm sure that you all will be immensely benefited by this program. This program is called in short CEP. I've called it CEP thinking CEP stands for Counsellor Empowerment Program. And I'm very, very sure that you all will be benefited.
I think we lost sir's connection. हिमांशु, अब सर का connection चला गया है क्या?
Yes, ma'am.
I thank sir very much for giving his sharing his feelings and for giving his best wishes. And I'm really, really lucky to have such a great, enthusiastic, expert counselors and clinicians. And I hope we will be able to bring out a good work from this meeting. So I think Dr. Richa, you can take over and you can carry on with the dialogue. This will be another interesting session where there will be a dialogue between two counselors. This is just a 5 minutes to 7 minute session. So I request Dr. Richa and Dr. Poonam madam to please start.
Yeah. Actually, Himanshu, can you share the slides? PPT?
Dr. Himanshu, please give the screen share option to Dr. Poonam Kashyap. Yeah.
Yeah, Dr. Poonam Nair.
Dr. Poonam Nair, sir.
Waiting for you, ma'am. Okay.
Can you make it slideshow, please?
Okay, all right. Hello. Okay.
Yeah, Dr. Poonam.
Yeah. So,
Ma'am,
this
can
is
you put on your video? We would love to see you there.
okay. It was. I thought it was stopped. It's not starting.
Yeah.
You are visible.
So this is a very typical scenario, and
Himanshu,
hello.
please make it slideshow so that ma'am can see and everyone will be able to see.
I can see the slides.
Ma'am, others will also be able to see if it is.
Yeah.
Kiske paas hai? Who has this? Who is sharing? Yeah.
No, it's fine.
Ma'am, please continue.
So this is a scenario where especially in the beginning, the new fresh counselors will face. We are trained in the mental health setup where people have mental health issues and they are open to talk about it. They come mentally prepared to discuss their personal life and so on. But here we have people who are actually just thinking ki, I want only my medical treatment. I want the baby. Now, why are they asking about my family? I mean, I don't want to share. That blockage is there. So even in the Western countries, they say only about 10% of people actually take up counseling. So it's not only our culture, but it family. You'd say like, it's none of your business. So here they say, we've come for gynec problem. Why is she asking? So this is where the counselor has to understand. We will get couples who will say, this is, we have no problem. We are fine. We are looking forward to the treatment. We don't have any stress. We are just here for medical treatment. We don't need counseling. We are not mental. We don't have to share our problems with you. We have family. We have friends. We just want for the baby, not for any lectures. So this is a scenario. What would the counselors say to this? What was the clinician going to say to this? can we force them for counseling? Obviously not. That is the very first thing, that you have to respect the boundaries or the narrative which the person has set for themselves. We have to respect it and move within their framework. Then otherwise we are advising, or we are teachers, or we are lecturers. We are not counselors anymore then. So here, what can we do? What can be the situation? I want everybody to think about it.
Yeah.
So, yeah, teacher.
So yeah, this is a very important question and a very good question, because I also come across many patients who are not interested at all into the counseling session. But when we'll make them explain like why it is required. So first thing I think which we should explain, that why they have been brought to us. So it is very important that we should give them the answer to why, because they have asked you कि हमें तो जरूरत नहीं है, हम तो मेडिकल उसके लिए आए हैं. तो we really need to tell them कि जो भी हम ये फिजिकल एस्पेक्ट्स देख रहे हैं, लाइक वी सी, हम अल्ट्रासाउंड भी कराएंगे, हम इंजेक्शंस भी लगवाएंगे, हम जो है स्कैन्स के लिए भी जाएंगे, और हम डॉक्टर विजिट्स हैं, चेकअप्स हैं, वो सब करेंगे. सो दीज आर ऑल लाइक एक सिंगल चीज है जो आईवीएफ के एक चैप्टर की वो है. तो इसमें वी नीड टू टेक केयर ऑफ आवर स्ट्रेस वाला पार्ट ऑल्सो, एंड which definitely we know that you are not feeling. We also don't want to scare the patients actually, कि हमें उनको ऐसे डरा दें कि आगे जाके आपके साथ ऐसा हो सकता है, वैसा हो सकता है. We cannot even do that. So we really need to tell them कि हाँ, हम इस जर्नी पे निकल चुके हैं, and every journey have their own ups and downs. तो उस up and down को हमें कैसे मैनेज करना है, कैसे अपने इमोशंस मैनेज करने हैं.
पेशेंट कहते हैं कि हमारा कोई डाउन है ही नहीं, हम ठीक है, हमारा कोई डाउन ही नहीं है लाइफ में.
Down, yeah, that is understandable. It's like we can ask them certain questions, somewhere they will click on something. Like if we can ask कि अच्छा आप सो कैसे रहे हो, आपका मूड कैसा हो रहा है, इन सब पे अगर उनका हाँ आएगा भी ना, तो एक क्वेश्चन जरूर है जिसपे वो ना बोलेंगे, एंड दैट इज कि क्या आप बहुत सोचते हो, क्या आपका दिमाग बहुत ज्यादा चलता है, नेगेटिव थॉट्स बहुत ज्यादा आते हैं. तो वहां जाके पेशेंट जरूर क्लिक करेगा कि हाँ मेरे साथ ये जरूर होता है. या एक क्वेश्चन ये कि आपको बहुत गुस्सा आता है, तो वो भी कहेंगे हाँ मैं चिड़चिड़ा हो गया हूँ, मुझे बहुत गुस्सा आता है. तो इन चीजों पे
डेफिनेटली नहीं, मुझे कुछ नहीं है, मैं ठीक हूँ, हम खुश हैं, वी आर वेरी ऑप्टिमिस्टिक, वी आर रियली एंथुसियास्टिक, हमको तो बस बेबी चाहिए. Now, this is also happens. They are very optimistic in the beginning. Sometimes they think, okay,
yes, actually,
this is our time frame, and we'll get
this
the baby.
this again we can consider as a mental problem actually, because वो एकदम हाई में है उस टाइम पे, इसलिए वो इस तरह से रिएक्ट कर रहे हैं कि हमें कुछ जरूरत नहीं है, आप ये बेकार की चीजें करा रहे हो. But once they will stumble upon it, then they'll realize. तो उस चीज को उनके ध्यान में डालने के लिए we need to tell them कि ठीक है, now you are completely fine. Over the period of time, anytime you are feeling stressful या आपको कुछ भी requirement लगता है, we are there to help you. Then this is the best thing which we can do. कि we can always assure them कि आप आगे कभी भी कुछ दिक्कत होगा, we are always here. Till then, you can maintain your lifestyle, have yoga sessions. क्योंकि generally क्या होता है, whenever patients come for IVF ना, वो most मतलब 50-60% I see that they say कि हमने ना एक्सरसाइज करना बंद कर दिया, हमने फिजिकल एक्टिविटी बंद कर दिया. I ask them why, क्यों बंद किया, तो they always have an answer, IVF करा रहे हैं ना, तो उसमें तो ये सब हम कर नहीं सकते.
So I think basically what we have to check on, keep in mind as a counselor, is that even if they are not showing any emotional distress, maybe they really don't have, because please remember 80% of them are resilient human beings. They are mental patients, 80%, and we may be proud, okay, 80% hai, but don't forget कि जो 20% आपके high risk में है, that is already 6 times higher than the normal population. जहाँ 3.5% mental illness थी, हमारी already हमारे group में 20% हो चुकी है. So it is not an achievement कि चलो 80% normal है, because somewhere the stress is going to be high, and it's that specifically infertility ART treatment stress is going to affect all aspects of their life. They are unaware of it. We as clinicians, as psychologists, know what they are headed for. So
Yeah.
we have to still prepare them for the journey. And initially respecting their boundaries, generally, it is the recommendation of ASHRI that we have the information, giving the correct information process as a way of establishing a rapport. So we have, like Dr. Pankaj said, a checklist. Yeah, अच्छा, do you know everything about IVF? अच्छा, आपको ये भी पता है? Cross check, do you know कि आपको ये injections लगेंगे? आपको पता है कि most of them are not biology people. So they do need a very clear, maybe with good diagrams, with good visuals, so that their path, the journey path becomes clear. So that itself is the very first step of the counselor, giving them correct, balanced information. Then
Yeah.
checking on the lifestyle, because lifestyle is a risk factor. A lot of youngsters, whether they are aware that how they're eating, sleeping, and other habits are going to affect their stress levels, their reproductive health, and general health. So these things have to be checked out. And then the fact about the outcome is that, okay, we are optimistic, you are optimistic. Look, the medical team, so many people are working together. The embryologist is controlling the environment. We are having such precise hormonal doses given to you, all to optimize.
Yeah.
So this is, where the whole, a sort of reality check that yes, there are 10 people who are working to give you the best results. But remember, we are not God. The delivery of the baby is 40% in their hand. Where is the unknown factors? You have to be an active partner. Improve your health, improve your lifestyle, and then slowly, that when you're having disturbed thoughts, the entire biochemistry of your body changes. Only you know your mental state 24/7. Nobody else knows. So you have to be an active partner in this journey.
Yeah.
You as a patient have to take charge of this very important dimension of care. Your self-care is in your hand, and that actually can increase your pregnancy rate. You're spending so much time here, you're spending hard-earned money. We want to give you the best, and this is why we want you to work with us, to actively look after your mental and physical health. So right now you're good. Let's hope that you will remain good also. Let's hope you'll go with the baby. But the science has limits. We just are going to try our very best. Please remember that. So somewhere, some patients say, no, that clinic is saying 90%. I said, okay, you're welcome to go there, but that is absolute lie. There is no 90% in the world over. You can go to USA, you can spend lakhs of rupees, 90%, that is not the science. That is then something else is playing up. So generally, then they do get aligned after this interaction, and they start, at least they are open to the idea of self-regulation, self-management, and that there is one point contact here in this setup. Somebody who will listen to them, somebody who will address their small issues, which are small for the clinician, but quite big for them. And, receptionist ne rudely bola, she was angry with me, or, some small things which which as a clinician is busy organizing all the biochemical variables. It's a huge handful. You don't expect them to be having the time or the attention for the other aspect. It's fair enough,
Yeah.
So, that is what I think maybe we can do.
Yeah, that's a really great input, Dr. Poonam. And I think that is the better way to explain the need for counseling to the patients. So I think we can go ahead with the Q&A, Dr. Peki. If some
There's one question already. Someone's raising hand.
If somebody wants to ask or put any comments or suggestions, we can go ahead. 2-3 questions we can take. Otherwise, Astha will now be telling us about the app. So, or we can take the questions at the end. Okay,
Okay.
so I request Astha now to please come in. She can share her screen and show us how she's going to launch the app later on, and how the Google form is to be filled, which I have shared in the WhatsApp groups, all WhatsApp. I want to congratulate Dr. Poonam Nair, Poonam Kashyap, and Richa for a wonderful job. I think that was a very nice session, giving a realistic view of how things happen and how you can, really ease the patient's fears, concerns. They feel comfortable after going to the class.
Thank you.
Over to us.
Thank you, Dr. Picky. So hello, everyone. I'm just going to give a sneak peek into the app that we are planning to launch. So the problems that were discussed and the problems that we can solve with the app. So first and foremost, it's not intended to replace doctors or counselors. It is something that is intended to work with the counselors to support the patients. Right now, we have problems like patients don't have access to doctors, counselors, and support 24/7. And these emotions can happen at any time of the day. The other thing is caregivers. So whether that be partner or loved ones that we were talking about, they might need support and they don't have access to doctors, counselors 24/7. Then what these people have access to is a lot of unverified healthcare information, which is on platforms like Google, Reddit, online discussion forums, which causes more confusion amongst the patients, like Dr. Poonam was talking about the 90% rate and things like that. There's also fears and doubts in starting the IVF journey. There is communication issues. People might be struggling, or they might feel like it's a taboo. And, in culturally, there are so many things that work in place like that. There can be lack of community support depending on what the patient's environment is. And then also a lot of these online access that people have to information, one, it can be non-verified, but also there's a lot of cultural context that comes into play. So having a digital app in customers' phones, like in patients, caregivers, when they have this app, it can basically solve these issues as an additional support, which goes beyond when they're at home, when they're in odd hours needing some support. It can also help people with disabilities, like if they have visual disabilities, we can use technology to support them. Maybe it can be translating knowledge articles or stories or case studies like this into an audio format. Also, Dr. Richa and Dr. Poonam, the role play that they were doing, they were talking about, the importance of things like meditation, activity, sleep hygiene. All of this can basically be tracked by a lot of the patients will tell you information, but you don't know what their perception is. The information that they're giving you about their sleep hygiene, about their activity, their meditation routine, all of that is their perception of how good they're doing. But using this technology, we can actually have the data in terms of, did they complete the meditation exercises that were given to them? How well are they sleeping? How good is their activity? And this can help with early intervention. It can also help in cases where we were just talking about, where they're not open to sharing things. They're like, hamare saath sab acha hai, like our lifestyle is good. So historical data, we can anonymize it for patient privacy, but historical data can be used to show how, stress factors impact the success rate, how sleep hygiene, how meditation, how overall lifestyle impacts the journey and the success rate. So this is the idea of the fertility journey support app, where we can have access through mobile phones, through apps, and beyond all of this data collection, we will have an authenticated, verified source of knowledge, and that will be used to, provide our patients the right information that they need. And what the app can also do is, using these AI technologies, we can ensure that they are getting information which is very relevant to their specific situation. And so they can interact with these articles. Because there's a wealth of information available, and different patients could be going through infertility journeys because of different reasons. So it can give them a community support, and they can basically do a Q&A, which will result in responses that are verified, because our knowledge articles would be verified. So this is like a basic technical architecture in the backend that I wanted to talk about. The queries where our patients can interact with everything that is available on the app. And then we will do the backend embedding and retrieval. And this is the context. So when the patient is asking the query, the context is the most important piece, because this will ensure that every patient is getting information which is very relevant to their specific needs, their specific problems, and then the response will be generated. So we'll personalize, even though the app will have a wealth of information, when the patients are interacting with it, they will have information provided to them which is very relevant to their specific situation. And the registration form, I just wanted to share this. It's a very quick registration form. You just need to provide your name, email, birthday, affiliation, designation, and any comments that you would like to provide. This is a very simple Google form, just these 6 fields. So yeah, please do fill that out. And back to you, Dr. Picky.
Thank you, Asta, for giving us an overview of how the app is going to work. And this can be this Google form can be filled in by your mobiles. So I would really request all of you to please fill it up. And may I request all of you, whoever is able to come on video, so that we can have a group photograph. And I think we can have a few questions before Dr. Geeta would be giving her concluding remarks. I request my core team to please open up their videos. Dr. Leena is here, Dr. Shweta, Dr. Renu. Yeah, that's good, because at least everybody who is there, Dr. Amita is there, great. All the participants also, if you can open up your videos, Dr. Rajni Bagga, then it will be good. We can have a photo together that will remain with us for a long time. So please open up your videos. Yes. So any queries, meanwhile, we can take up some queries, because the experts are there with us. And any suggestions, any queries. Actually, we are preparing this checklist of how each session should be planned, and what all things are a must to be done by the ART counselor. Because many of you are not going to be the biology people. So we are giving some information and how to go about it. A ready reckoner, which can be placed with the ART counselor in each clinic. So with that, we have 6 teams. Each team, as I said, will be clinicians and doctors. So we are preparing this checklist. So we would be glad, and we are going to have 6 such sessions where each team will be demonstrating this work. This work today that we presented has also been done by Dr. Amita Puri and Dr. Veena Acharya. I acknowledge and I thank you both for being there with us. And any suggestions, any questions, any queries, any critical reviews regarding this are most welcome. Dr. Leena, would you like to add something? Dr. Leena, you are muted.
Yeah, thank you, Dr. Vicky. It was a wonderful session, I'll say. I enjoyed the play thoroughly. between the counselor and the patient. It was very good. And I was thinking if we can have a continued series of that patients and what the counselor told that in next visit, whatever we plan, the sessions, then the counseling with the partner together. So it will be very interesting to have a ongoing sessions with the same patient, and then we can have a team of counselors. The patient was very good. Definitely counselor तो ने तो अच्छा रोल किया ही.
We will have innovative ideas. Every time we will be having the same pattern. The clinician will be giving a small PPT presentation followed by a role play and a case narration.
Sorry to interrupt, Dr. Picky. I think Dr. Leena has a very good idea because we can proceed with the couple therapy and we can have, sessions related, followed up sessions like what to be done in another session. That's a very good idea.
We would wait for that session to hear from you.
Yeah, that's a really good idea.
Yeah, I think that is a very good idea. And each time we'll be having a different case also, We have kept PCOS, poor ovarian reserve, the person who is needing oocytes, donor oocytes, surrogacy, medical disorders, all those things we have kept it in mind. And each team will be presenting their own. And it will be great if other people also come up. But otherwise, I recognize three, in fact, great actors. This is Dr. Richa, Dr. Poonam Nair, and Dr. Poonam Kashyap. So, Dr. Poonam Nair has already promised to be there with us in all the teams and all the sessions because she is the expert regarding this. But I also got a lot of, encouragement and a lot of ideas from Dr. Geeta Khanna also, our other mentor, because she has so much of experience. So, ma'am, we would like to hear from you also. Thank you, Dr. Leena. That was an excellent suggestion, and we will definitely do as you said.
And I think Dr. Amita is very highly trained in certain aspects of deep counseling. So like this patient we showed, she is carrying trauma from the past. It is getting projected in the present time. So it requires some kind of subconscious healing. And that would make you aware that it's not just advising, it is not just talking. You have to recreate the life narrative through visual imagery, through deep subconscious connection before the actual healing can take place. Yes, everything helps. The lifestyle advice, the meditation, and taking social support. But when internally there is a block, that has to be. So I'm very happy. I'm sure Dr. Anita is going to give some very interesting demos to us.
I think, ma'am, we have, gems of people in each team.
Yeah.
So Dr. Amita is definitely going to do a good job, but so are others also. We have very enthusiastic and, very smart people with us.
Yeah.
So I'm sure all will be doing a great job like the one done today. So,
Yeah.
Dr. Geeta, ma'am.
Yeah.
Over to you.
So at the very beginning, I must congratulate Dr. Picky and the whole team, and especially Dr. Poonam to give us such a nice vision and beautiful role play, beautiful discussion with the counselors. And it is more underestimated, but it is a very, very important aspect. I think it really, if we part it actually, it means nearly 70% of the treatment. Counseling is so important, and a regular counseling, it should not be only a single sitting. And at time to time, at step and step, you have to have the same counselor in a nice, beautiful room, a cozy little room where a patient can, bank on somebody who is a very, very compassionate lady or a group of counselors who can counsel them from time to time. So the good work has been started, and we are hoping very good things coming up now. And basically, I'm also very happy about the AI app, which you are going to introduce. And let us see what goodness is done. And AI is the latest application, what we can have in the medical fraternity. Very nice. We are using it in the same thing. And definitely counseling is a real art. You know, some people, they are born counselors, born counselor. And some people, it's not that key. If you are not a born counselor, you cannot become. It can be acquired. It can be acquired by your compassion, by your instinct to become it. So it's such a nice, and I'm happy that you have divided the things so nicely that medical disorders, POR, you know, the amount of POR people we are getting, people not ready to understand, young PORs not ready to understand that they may go into oocyte donation and how come they are going and how their family is going to accept it or the husband is going to accept it. So it is important. So I think these are the areas where a lot of counseling is required, maybe more than one session. So that is important. So, and again, I want to congratulate you all. And you have given a very nice team and nice insight, and people must have been benefited. And I think in the coming up sessions, more and more people will be added up into the sessions.
And
Thank
a
you very
special
much.
thanks from all psychologists that you have put this initiative. It was really, really needed. Thank you so much, Dr. Picky and Gita and Dr. Talwar. Thank you.
And one more thing, in the Counselor Empowerment group, I request everyone to please give their short CV, and whoever is interested, we can take them in these role plays and all. We can take your ideas. That is the idea of creating this database, because we can use you people. You can use your expertise in these workshops that we are planning, webinars that we are planning. Besides the core team, it will be great because I see some very experienced people in the general group also. We have a limited core group, but we have a huge general. We have crossed more than 400 people in the general group. And I see some very, very talented people there. So I think we will be using your, expertise in our future programs and get more and more ideas. And the role play, I think, ma'am, can be done beautifully by on Zoom only, and it can be recorded. So this time we did a lot of effort. Dr. Richa, Dr. Poonam, both Dr. Poonam. It was a hit and trial method, but now we are wiser, and I'm sure Richa, Poonam will help in the future role plays.
Would love to. We would definitely love.
Yeah. So, if there are no more suggestions, I think we can call it an end. We have already crossed the time.
Yes.
I once again thank everyone to be here. And Himanshu, please take a picture of all of us, which we can, share in the groups. And Dr. Pankaj will also be wanting to see, because sir has, I think, gone in the installation ceremony right now, but he would be definitely, he was extremely, keen about this program, and he called me so many times because he was very worried that he should be here. So thank you very much. And
Thank
I think
you so much. Yeah.
okay, bye bye.
Bye.